and also is donned in surgical gown and so forth. So let me explain a couple of things we have here. This right here is called a non-fenestrated drape, and again, if it's in the pack, that means that what? It's sterile, correct? So I would open this up, and I could drop it in my field. And this is a fenestrated drape. What does that mean, fenestrated, non-fenestrated? It means one has a hole and one doesn't, okay? So this is a non-fenestrated drape, okay? This is a fenestrated drape. It has a hole, okay? So you can put your arm through, your fingers through. I have one that's a little larger where you can put your leg through. Or, as I'm going to show you in a moment, you're going to drape it over the patient, okay? Now, I just have them here prepared, but you would actually be using these when you are in the office. So, I have a few things here, and I purposely put this one here because when we test you, we're also going to have this out here. But I really would not be using this. This is the alcohol swab. When would I use an alcohol swab to prep? For phlebotomy, right? But remember, when we're doing a surgical procedure, it has to be free of all pathogens. So I'm going to need something a little bit more, okay? I'm either going to use the number one, which is povidone iodine, okay, swab. This is also povidone iodine swab. It's just made by a different manufacturer, okay? But if my patient is what? Allergic to betadine, povidone iodine, or shellfish, then I'm going to use ChloraPrep, which is also called chlorhexidine. Okay, so you as a medical assistant, you need to make sure that you ask your patients if they're allergic to shellfish or they're allergic to povidone iodine or betadine or anything like that. So of course I'm always going to do my two patient identifier. And what I did is I had an electrode here because this is going to pretend like this is the lesion where we're going to prep for, okay? So of course I'm going to introduce myself, ask the patient for their first and last name and date of birth, and then I'm going to talk to them first. I do not complete the what? Consent form, because the consent form is between the patient and the physician. My job is to make sure that I witness that it has been signed and that the patient understands the procedure. So then I'm going to ask the patient, do you understand what we're going to do today? And then we make sure that the patient understands and agrees, okay? So I would explain to the patient what I'm going to do. I would ask them, you know, if they're allergic to povidone, iodine, or betadine, or shellfish. Let's just say they're not. And then what I would do is I'd open up this. I'm not going to open it up right now because I don't want to get them all messy, but I would open this up. It has, well, actually I'll show it to you because you need to see it. Of course, I'm going to be having gloves on, okay? So you can see here, it's got, okay, a little sponge right here. Okay, it's kind of like a swab. Roll of betadine, right? So what I'm going to do, I'm going to put this right here. What I'm going to do is I'm going to prep because I'm going to be wearing, donning regular gloves, okay? So I'm going to prep here, and I'm going to go in a circular motion, going from the inside, going out until I get at least 2 to 3 inches in width, okay? After that, I am going to place my non-fenestrated drape. And of course, I have a little short guy here, so I'm going to half this. But if we were to do it for real, we would put this here, okay? Body's here. Next one. I don't have to cover his face, but I can at least put it here, okay? And the third one. Place here, and the fourth one, and the place on the other side. And actually, what I shouldn't do is I should be going over here because I should not be crossing the field. That's really what I'm supposed to do. All right, so now I've got my area that's exposed. Now, lastly, I take the fenestrated drape and I place this over the area, okay? And now the doctor is ready, okay? So now I'm a floater, I'm done. Now I can get the next person who comes in, the scrub tech, and they're gonna finish. So sometimes the scrub tech will do this too. So they'll do the surgical aseptic hand wash, because again, we wanna make this free of pathogens. The closure strips here, and this is Curlix. Sometimes we'll use this as super sponge to dress or to absorb any blood or fluids. This is another type of stretch band that we use. And we would also dress them or Curlix. We have Curlix here. And so we can wrap if we have to, or prepare. We can use Adaptic as well. So Adaptic looks like kind of like a little bit of mesh. It almost looks like it has petroleum jelly, but what it has is antimicrobial properties. So what we'll do is we'll put the steri strips on when we're all done. He's sutured, or she is sutured. We'll put the steri strips on, okay, to keep the closure, keep the incision closed, and then we'll put the Adaptic on it because it has antimicrobial properties, but it also helps with the healing process and hopefully won't allow it to dry out and become painful for the patient. And then we'll put all of our other dressings on top, okay? So for you, your job, you'll have to do a surgical aseptic hand wash, don your surgical gloves, remove the dressing, okay, depending on where it is, and then also remove the sutures, okay? So depending on where it is on the body, sutures are removed at different times. It could be 5 days, it could be 7 days, it could be 10 days, it could be 14 days, depending on where it is on the body, okay? All right,